繼續啊 ，Alan。
Let's continue. Alan, you have heard the Secretary's explanation, I suppose? Yes, certainly. Chairman. Now, according to the audit report for Caritas and PMH, they are going to do something to handle the waiting time of these hospitals. Well, I was not asking them to commit anything. It's a 5.3. We'll have to write a report, and then there will be further follow-up action. So for 5.15 and 5.35, and in respect of questions raised by Mr. Ng Liang Seng, please provide a written response. Chairman, 5.37, I have a question on that. In January 2013, if we check our meeting minutes, it's info 9. You may not need to take out the record. I don't think the Secretary is going to deny this. In January 2013, the electrical panel on health services held a meeting. A number of members raised questions about the waiting time of SOP clinics. The Secretary gave a promise saying that in phases the waiting times of different SOPC will be announced. If we look at table 25, the Director of Audit went to 7 ENT SOPCs, and during the visits, the Director found that in SOPC 1, everything required was done. It displayed its own waiting time. Other SOPCs in the same cluster, as well as waiting time of other SOPCs in all clusters, they were all displayed in the SOPC. But on the other end of the spectrum, in another ENT's SOPC in NT West, it displayed its own waiting time, but did not display waiting time of other SOPCs in the same cluster or in other clusters. Of course, this is not satisfactory, but in particular, in the light of the promise made by the Secretary in the meeting of the Health Services Panel in January 2013, that the waiting time will be displayed in phases. So I would like to know from the Secretary with regard to the measures to be taken by the HA to ensure that the information display will be consistent, and then the practices adopted in different SOPCs will be in line with each other.
Dr. Leung, yes, let me supplement. We do have a plan. We have the waiting time of 5 SOPCs available online at the moment. As for the remaining 3, for surgery, internal medicine, and psychiatry, we expect the information to be available in the first half of this year. As for the display of waiting time in the clinics, we anticipate that similarly in the first half of this year, the information will be displayed at all the 7 SOPCs. Yes, give us some information in writing later. Which clusters, for example, well, I don't know whether Dr. Koh has anything to supplement. I accept the arrangement mentioned by Dr. Leung. Now, one final question. Chairman, now according to the audit report, 46% of the annual expenditure is spent on elderly patients. Now, we heard from Dr. Ko that there is no need to reinstate the Department of Geriatrics under the existing arrangement, and yet we also see for GOPCs slots are available, especially for elderly patients. That's the case for GOPCs, but not for SOPCs, meaning that no special quotas or slots would be available for elderly patients. Now, with a rapidly aging population, my question is whether you would consider for specialties that elderly patients need, internal medicine, for example, whether a special queue can be set aside for elderly people. Well, let me just give you some of my ideas, and then I'll defer to Dr. Leung. Now, we're talking about GOPCs, which is quite different from SOPCs. For GOPCs, some of the quotas or slots would be reserved for incidental or acute diseases. For example, you may make the appointment today for, or make the booking today for the appointment tomorrow, and for sporadic diseases, and therefore, some slots could be reserved for elderly patients, but for SOPCs, as we explained just now, referral from GPs is needed. And with the referral letter, the elderly patient can then visit the hospital, and the nurse responsible at the triage will ask some questions to get information for an assessment of the patient who has come with the referral letter, and to consider whether or how urgent the patient's condition is. And everything, including the patient's age, will be taken into account. This is one of the factors for the comprehensive assessment at that time. Alan. Chairman, I think I have tied loose ends. Paul, any other questions? Chairman, I have been listening to the meeting. I think basically we other members have dealt with the issues outstanding. Secretary, well, in these 2 weeks, when we're writing report, when necessary, we'll write to you and ask for more information. Yes, we'll liaise with the Secretariat. And Dr. Leung, would you please, paragraph by paragraph, about what you have about the undertakings you have given to the Director of Audit. Please give us a timetable roughly when you are going to improve things or make arrangement for that, instead of just telling us that you accept the recommendations in the report. We need some concrete proposals, timetable, work plan, for example. Well, what you mentioned just now, we need the information in our report as well, because after writing a report, we also need to follow up on your work. So thank you. Thank you, Director of Audit and your team. Thank you.